Hello everybody, Perko here with the first of this year's pontifications, and this one, if you haven't read the notes, is on health insurance, costs, reasons, health conditions, and I focused on the United States because I think it's the best barometer of healthcare, although of course in different countries things are a lot different. But I'm doing it with just American statistics because frankly they're the easiest to find. So what I've done is I've looked at the statistics going from 1965 to 2025, so a 60-year period. So any where it starts is 1965 and where it finishes is 2025. I'm going to start with my own personal experience with health insurance and, my stories. Well, I would, but I haven't got any. The main reason being is because I've never bought health insurance my whole life. You may think, what a daft fool you are. Well, I don't know about that. The main reason is that in 2/3 of my life, I've spent in countries where they have a national health service, a free service which you pay through taxation. One is the UK and the other is New Zealand. The other third of my life I've spent in different places, 5 years of it in the US, I have to say, and I never had insurance. Main reason being is I always thought I was too healthy to get sick. I suppose, for the most part, I'm right about that. Even at close to 80 now, I still don't take medication, although I have to admit, a few days ago I got an earache and I needed a bit of painkiller and a few antibiotics. What a wuss. Anyway, I digress. So, I'm going to my notes, and to give you an idea of how health has changed, how the costs of health have changed significantly. The cost of keeping the average citizen in the US in 1965 healthy was $209 a year. Today, it's $10,000 a year. And why is it so expensive? Well, the healthcare industry makes a nice $500 billion profit every year. So there's a good chunk of it right there. And when we look at premiums, a family premium today costs you around $27,000 a year. Back in 65, the cost of a premium was about $100 a year for a family. Some people were on individual policies. They're paying $10 a year, as little as that, for individual young bloke, for instance. And now let's have a look at some of the illnesses and see how we are a lot sicker than we used to be. So I've looked at 4 illnesses. One is diabetes. America went from 1.2% of the population to 12% of the population with diabetes. Cancer went from 1% of the population to 5% of the population. Although that said, the survival rate has increased from 39% to 67%. So that's an improvement. Heart problems has gone from 1% to 2 to 3% of the population. And the biggie, which you're probably already aware of, is hypertension or blood stress issues. Gone from 15%, which was bad enough, to 47% of the country's entire population now have these issues. So, what's the solution? Well, I put Tom Cotton in there because dear old Tom, he held a committee meeting and he came up with this bright idea that he was going to take sales tax off of insurance premiums. So what does that do? Does it change anything? No, not a sausage. All it means is that money that would have been paid by the people paying for those premiums, so they're a little bit cheaper, it means that money will now be piled on the national debt because the government won't be getting it in tax. So I don't see that's helpful. So why have we got these problems? Well, I don't think you have to look much further than the food industry. If you look at all the junk that they put in food, ultra-processed foods, you'll know that there's a lot of stuff in there that our bodies are not designed to metabolize. So I think if we really want to get away from all these issues with that, we need to start looking at eating more healthily. And I'm not quite sure how we do that unless we all move to the country. One other statistic I will tell you, because people will say, a lot more old people now than there used to be. Not exactly true. In 65, there was about 9% of the population was over 65. Today, it's only doubled, 17%. So, that's the pontification for today. I hope you found it interesting. Comment if you like. See you next week. Ta-da.